Do you often wake up in the middle of the night? What is this caused by and how to fix it? Find out in this video. It's interesting to note that waking up in the middle of the night is normal. And any healthy person wakes up every 1.5 to 2 hours for a few seconds. That is, a healthy person wakes up, but he doesn't remember it. He falls asleep and forgets by morning that he woke up at all. If you have frequent awakenings in the middle of the night, you remember this, it bothers you, it disrupts the quality of your sleep, this is a serious problem. Today, we will figure out the reasons and how to deal with this. Watch this video to the end, and you will get a series of useful tips on how to deal with and eliminate night awakenings, which are caused by ingrained conditional and negative reflexes. Fear of not falling asleep and insomnia. A bit of physiology. Sleep is a fairly complex process for us, proceeding in stages and cycles. First, second, third stage, then rapid eye movement sleep, dreams, and then physiological arousal. And in fact, this situation with the sequence of arousal stages is called a cycle. After each sleep cycle, which lasts an average of 1.5 to 2 hours for people, any healthy person wakes up in such a way that it reaches their consciousness. For a few seconds, he opens his eyes, tosses and turns, changes his position, falls asleep, but forgets that he woke up because he absolutely doesn't care. And it turns out, even if we conduct a study on a healthy person, so-called polysomnography, we see that the person, by the way, says, "No, I didn't wake up." During healthy sleep, a person forgets these awakenings, and they absolutely do not bother him. A person reports sleeping soundly throughout the entire night without interruption. At the same time, if a person starts to have awakenings that he remembers that disturb him, he wakes up in alarm and thinks, "Oh, I won't fall asleep now," and he really doesn't fall asleep, not just for a few seconds, but for several minutes or even tens of minutes. This is already a serious problem. And today we will figure out the reasons, and then I will give advice on how to deal with this. There are several groups of reasons, I would even say. The most obvious reasons on the surface are the so-called somatic ones. For instance, needing to urinate often at night. Yes, and a person just gets up to urinate, well, because he has problems with the prostate gland. Sleep apnea, for instance, leads to frequent urination during the night. If you get up to urinate 2 or more times, like this video, and we will assess the frequency and severity of nighttime urination among our viewers and the significance of the problem, a kind of sociological study. Next, a person can simply be in pain. Well, for example, he has some kind of aching joint and constantly wakes up because this joint hurts. What else can happen? It can even be in relatively healthy people. When a person thinks it's beneficial to sleep on a hard surface and chooses a hard mattress, in fact, he experiences pressure in several points, so-called pressure points, and the body signals the person that he has been lying somewhere for too long and needs to turn over immediately to prevent bed sores. And the person also starts to wake up more often, precisely because he has chosen an uncomfortable mattress for himself. Or he just ended up sleeping on an uncomfortable mattress. The next group of causes are the so-called sleep disorders. It seems we don't have healthy people, just under-examined ones. Good medical humor, right? And there are diseases that are accompanied by frequent awakenings in the middle of the night. First and foremost is the so-called obstructive sleep apnea syndrome or sleep apnea disease. I have a separate video on this topic where a person snores loudly with snorts with pauses in breathing during sleep. And there can be hundreds of these pauses in one night. But it's clear that a person doesn't wake up at every pause, but sometimes he wakes up from a feeling of lack of air with a feeling of suffocation and can wake up from the fact that he lacks air. In this specific situation, especially if the person is overweight, of course, you need to see a doctor, conduct an examination, make a diagnosis, and prescribe treatment. This also applies to the so-called restless leg syndrome and periodic limb movement in sleep. This is also a fairly common disease, predominantly among older age groups. When a person in the evening, at rest before sleep, experiences an indescribable but extremely unpleasant sensation in the lower limbs, forcing them to move. People describe it variously as tingling, electricity, itches, a thread, or pain. But once a person moved their legs, the sensation passed. As soon as they lie down again in peace, it reappears and gradually grows unbearable. This is still in some kind of... This disease was described, and it was said that a person essentially feels as if they were under a guillotine. And I will say that I really do have patients who come to me for consultation and talk about suicidal tendencies because of this, because they have this extremely unpleasant feeling that constantly prevents them from sleeping. But the other side of the coin, the syndrome of periodic limb movements in sleep, even when a person has fallen asleep, the legs continue to twitch, sometimes several hundred times an hour, and periodically wake the person up. The person wakes up, he doesn't understand that his leg twitched, but he wakes up. For some reason he can't sleep. Well, actually, this is a block of sleep disorders. And the third, it's not obvious, but no less frequent, even more frequent, these are so-called fixed conditional reflexes. And how does the problem form? If a person really has some stressful situation that disrupts a person's sleep, he starts trying to sleep. Just trying is enough. A person develops a strong conditioned reflex of fear of not falling asleep. He may want to sleep, but as soon as he approaches his bed, sleep disappears. And next, if a person tries to fall asleep, where is he? He is in bed. And the following conditioned reflex is formed, that the bed is not for sleep, but for insomnia. That is, a person can lie in bed and think about what a nightmare. The mattress and pillow are terrible. The light, sound and noise are off, making it impossible to sleep. And now imagine a situation where a person has some kind of stressful situation, and insomnia has formed a reflex of fear of not falling asleep, and the bed insomnia. Somehow a person falls asleep, then he sleeps his full cycle of 1.5 to 2 hours, and then there is a physiological arousal, which occurs in any healthy person who almost does not notice it. But what if a person wakes up with a formed reflex of fear of not falling asleep and the bed becomes terrifying? What will he think? He will think, oh horror, I have a problem, I will not sleep now. And this hateful bed is here again, right? Stress, a surge of pressure, a release of stress hormones, a person does not wake up at all, wakes up and may not sleep there. And then for half an hour. And this can further exacerbate the situation and further reinforce the fear reflex of not falling asleep, because now not only the primary sleep is disturbed in a person, and more. He tries to fall asleep and he fails again. And he lies in bed without sleep, and further on, the fear of not falling asleep is reinforced. Well, how else does a person further aggravate the situation? By trying to stay in bed longer in order to get some sleep. The earlier I go to bed, the later I get up, probably I will get enough sleep. But when a person starts to lie in bed longer, let's say he needs to, and he lies down, this spreads out, and if a person will be in the middle of the night, that is, the person says that I often wake up and then have problems with sleep, superficial, restless, non-refreshing sleep with frequent awakenings. This is a very characteristic situation for people with chronic, such a fixed, conditioned reflex insomnia and so-called maladaptive behavior when a person lies in bed for too long. Share in the comments about what problems you have in the middle of the night. How many times do you wake up? How much do you not sleep after you have woken up? I will familiarize myself with the comments and maybe give you some specific advice on how to deal with this. Now, specific advice on how to get rid of night awakenings. If you suspect you have some serious somatic disease, like the same syndrome of obstructive sleep apnea, snoring, gasping, cessation of breathing in sleep, it is advisable to see a doctor, undergo polysomnography, make an accurate diagnosis and prescribe appropriate treatment. This also applies to restless leg syndrome, when unpleasant sensations arise that interfere with falling asleep or maintaining sleep. Or any other problems, pain, frequent urination, and so on. This requires attention from relevant specialists. And as I said, the most unexpected awakening in the middle of the night, these are ingrained conditional reflexes, and bed insomnia, also a reflex. And in this situation, so to speak, even the name of such insomnia, it's the Pavlovian model that is against the background of ingrained conditional reflexes, like Pavlov's dog. Or it's also called conditional reflex insomnia, when a person physiologically wakes up, but then can't fall asleep because his reflexes are triggered. So, in this situation, what can a person do himself? First of all, to see how long he lies in bed and correlate this with how much time he had to sleep before his insomnia developed. If it turns out that he has increased his time in bed, for example, he used to have enough, but now he lies down, he needs to reduce the time to maybe even remove an hour to induce a real sleep deficit to increase sleep pressure. And even if a person wakes up in the middle of the night and wants to sleep thinking, oh, I won't fall asleep now, he will fall asleep. That is, his awakenings in the middle of the night begin to shorten. After some time, he starts not to fear them so much because he falls asleep quite quickly. And then, if he falls asleep quickly, he just starts to forget, like any healthy person, about the fact that he woke up in the middle of the night. But in this situation, you need to be in a certain sleep deficit. That is, to lie in bed even less than you had enough before insomnia, for example. If you had enough, try to lie down and sleep will become much more stable, much deeper, and even these physiological awakenings, and if they will be, then at the end of the ends you will just stop remembering them. You will form a normal positive reflex. Closed eyes, already opened. Morning. That's how to deal with this. In principle, it's quite simple to handle. Although, of course, if these are long-standing reflexes that have taken hold, and you have already taken medications and have been to psychotherapists and so on, and nothing has helped you, now all the standards for treating chronic insomnia have completely changed, especially this conditional reflex one. If earlier medications, pharmacotherapy, were in the first place, now so-called cognitive behavioral therapy is. And now I'm curing it. Such conditional reflex ones, with problems with falling asleep, awakenings in the middle of the night, early awakenings, just with certain behavioral recommendations. Limiting sleep, not lying in bed without sleep, regular physical activity, relaxation techniques, nutrition, sleep hygiene. And in fact, I am training a person new on how to sleep well. And this is very effective in helping to eliminate these conditioned reflex awakenings. In this video, I explained that stress and insomnia form conditioned negative reflexes in us, fear of not falling asleep, and post-traumatic insomnia. I have a mini book dedicated to stress and insomnia, diagnostics, assessment of the situation. You can see what level of stress you have and what degree of insomnia. And most importantly, there are clear sequential recommendations on how to deal with this. In the description to this video, you can find a link to this book. You can correct the situation in a corresponding way by reading this book,